I always say that if you're perfectly satisfied with your results, then you've ended your knowledge. You have to continue to learn. And I'm in practice 50 years, and I'm really excited because I'm learning something new.
Thanks, Warren. I appreciate it. Really, I'm enjoyed to spend this time here in the United States to to go on to the research in fascia, to teach fascia manipulation, because it's important for us that these techniques are be present in all over the world, in other countries, here in the United States, but already in Japan, Russia, South America, and right now in most of the country in Europe. So your collaboration is great, and we will see the result immediately here in the United States, because we have already finished 2 courses, and all the students they use fascia manipulation every day, and from the blog it's pretty easy to understand that the result that they can give with this technique are really very exciting for them, and the patient can realize that just with few treatment, sometimes it's just with 1 treatment, they can have a result that till now no one have this possibility. And so I think that we have to go on with this direction, because it's very important for the operator, but also for the patient, have the result as quickly as possible. And I think that this technique could be very helpful for help all the therapy about myofascial syndrome, and so also for us.
You know, Antonio, the most exciting thing I'm finding is that this has, your father, he has blended Western and Eastern medicine. And he's taken this information, he's known about this, but information is coming out now that the whole acupuncture system is associated with the connective tissue system. And he has found these specific points in the connective tissue system, which happens to be acupuncture points that seem to have a much greater effect on healing than just any particular point in the body. And the best thing about it is that these points can be found by way of a functional examination. So if somebody bends a particular way and they have pain, there are particular points you have to look at because of that limitation or painful movement. And then the most exciting thing is you treat those points and the movement improves and the pain diminishes. And probably most important of all, associated with this, is that we learn this whole kinetic chain of fascia and acupuncture points together. So, you know, you treat an ankle and a chronic low back pain goes away.
No, is this true? Is it true? Really, we have spent a lot of time in research. We have started from this section in the embodiment cadaver for analyze exactly the anatomy of fascia, the anatomy of deep fascia, in particular the insertion of the muscle fiber inside the deep fascia. That was a key point for understand how can work the biomechanical model of fascia manipulation. After that, for sure, it's important to understand the physiology of fascia, because we know that the sliding system between deep fascia and the epimysium, but also inside the deep fascia, between the different layers, are very, very important for the coordination. You know, there is the mechanoreceptor inside that, so if the sliding system decreases, you can have a hyperstimulation of the mechanoreceptor and nociceptor. It's for that different kind of musculoskeletal dysfunction, musculoskeletal pain could be resolved with this technique, because the sliding system decrease with our particular technique. We create a friction, we increase the temperature, we create a particular inflammatory reaction that permit to resolve this densification, like we call. And we are quite sure that is that densification that is the problem that can create pain, the musculoskeletal pain. So I know we need more research, and we are going on in this direction, because also we are working with the rat, and we are trying to create a sort of overuse syndrome, or a sort of immobilization, to understand exactly if that one is the etiopathogenesis that could be correlated with musculoskeletal dysfunction, or shoulder pain, or knee pain, hip pain, low back pain. So this particular kind of pain that with MRI, CAT scan, you can understand what's going on there. There is no a morphological dysfunction, no alteration of the morphology, but the patient have pain. And so we think that that kind of pain are really straight correlated with the alteration of the deep fascia.
You know, Antonio, this is so exciting. I mean, a patient comes in with anterior patella-like pain, and for years I'd look around at different areas, but I concentrated on the patella. I concentrated on the site of pain and where they felt it and did a lot of different things. But now with this knowledge of the fascial system and these certain points that are usually proximal to the site of pain. I mean, imagine going to an area that the patient never even knew about and finding this dense tissue and freeing it and then conducting a test that aggravated their knee and it's all better and they feel better. It's very, very exciting. I mean, we all remember Carl Levitt and his famous statement. He says, if you worry about or just treat the site of pain, you're really lost as far as understanding what's going on. And it was very prophetic of what he said many years ago.